All right, forget about the health of the markets this fall. What if I told you we should all be more focused on just our plain old health this fall? Because if recent warnings are right, not only is swine flu still a threat, this fall it could morph into a global plague. Now, how bad could it get? My next guest says potentially very bad, and she should know. Dr. Svetlana Kogan recovered from the swine flu a few months ago, joins her right now. So, doctor, we're kind of a little too comfortable with this, aren't we?
I'm not comfortable at all with the way it was handled. And, you know, I had my swine flu in the middle of May, just at the beginning of the epidemic. I had it together with my 8-year-old daughter.
Really?
And the experience we've had was so miserable and so pathetic in a sense that, you know, the healthcare system was absolutely unequipped to deal with people with the swine flu epidemic.
Well, how did they know it was swine flu, and how did they handle it for you and your daughter?
Well, first of all, both of us had severe fever, shaking, chills, cough, nausea, and vomiting simultaneously. Despite of the fact that I was sick, I obviously took her to the emergency room, where she did not get swabbed. The chest x-ray was not done. The blood count was not done. She was not given any medication. She was sent home with presumable H1N1 virus. So what I did is I went to my good old office.
So they already assumed that that might be the case.
Exactly, but I had to swab my child in my doctor's, in my office, in my medical office. What about all the other mothers out there with their kids? So the CDC's policy was to have the hospitals not swab children and adults for presumed virus. And because it's a viral disease, to advise them to stay at home and have the viral illness run its course, get some supportive care. So, you know, this definitely is not what we as a superpower should provide our
But you're arguing that
with.
this could develop into something we didn't appreciate or see in the spring when you were diagnosed. Now,
absolutely.
In 1918, with the first hit of something like this, it was relatively mild. Not mild, but it was not taken to be the severe thing it would prove to be in the fall of that year. Our attentions were elsewhere in a world war and what have you. But millions died. Now, what are you envisioning this fall?
I envision that we should take this disease very seriously, and our government should provide us all with the swabs for us to keep real statistics. If we don't have the good statistics for the virus...
When you say the swabs, what is that? It's just a means by which you can...
are wooden sticks with a little cotton on the tip. You can reach into the person's nose and collect their fluid, which you can send to the lab to check.
And you readily know how many people have this.
Absolutely.
And you suspect more have it than we know.
Let's multiply this by the order of magnitude. Many, many, many more people had this than we know.
And a more severe strain, potentially? Or what do you...
Of course. A lot of people that I personally knew, my patients, had severe, severe cases of this disease. People without any pre-existing conditions were in severe respiratory distress. And,
so for you to look at something that might be spreading beyond what the medical community is saying, what do you look for, doctor? What would be an alarm to you that you would say, this is worrisome?
An alarm would be a high fever, cough, shaking, chills, nausea, possibly vomiting, some vague abdominal symptoms.
And a lot more people getting it.
Yes.
And readily identified as people getting it.
Yes. And
do we have enough of these various vaccines that are supposedly meant to address this out there?
Well, first of all, we do not have a swine flu vaccine available. We have a regular influenza vaccine, which is going to be extremely important this year because the regular flu is still out there. It's coming late September, so we should be immunizing people against that.
But they say that's something we didn't have in 1918, so no comparison and hence no need to worry.
We should be worried, and we should put pressure on the government and on CDC to perform more human trials with the existing swine flu vaccine to decrease the incidence.
Isn't it?
No, we have to work on the side effects of this vaccine. We have to deal with what we have.
A lot of folks are going to worry real quickly, doctor, that if you have little kids, many people, I have 2 little boys, I'd be worried about giving them a vaccine these days.
You would be afraid to give the vaccine to the child?
Which should I worry about more, the vaccine or what can happen if they don't?
Good question. I'm not normally a pro-vaccine type of a person, and I'm not a pro-vaccine physician. However, having seen my daughter almost lose her life to swine flu, I would seriously consider giving her a vaccine next year because she's already immune for this year's strain. But we should seriously consider manufacturing a vaccine with good side effect profile, low side effect profile, that is, so that we can immunize our people and protect them.
Wow. Doctor, thank you very much.
You're very welcome.
Good words of warning.
It's my pleasure.
She has been there, done that.